Yeah. Let's return to the issue of COVID affecting medical experts. Now, General Secretary of the Ghana Medical Association, Dr. Titus Bayo, earlier revealed that the number of doctors affected have increased. Now, we're joined on the line by Dr. Michael Owusu of the Kumasi Center for Collaborative Research. Doc, many thanks for your time. We've been taking a lot of your time this week, but of course, this is an important discussion, so we need to have you in it. So I'm sure you've heard a lot of your colleagues talking about the fact that a lot of their friends are being infected by this virus. They've been exposed to it because most often they run out of PPEs and they are forced to give it to the patients at the risk of exposing themselves to the virus. How does this make you feel from where you stand as an expert, you know, on this matter?
Yes, so this is quite disturbing, and this also has happened across different countries, and especially with a virus that is highly contagious like COVID. I mean, this SARS-2 coronavirus. And I mean, if you look across the African countries, over 6,000 health workers have been infected, and quite a significant number of people have died. If you follow through this virus from China, through Italy, through the United States, and in Brazil, quite a number of health workers are the people who seem to be at the edge when it comes to becoming infected and also succumbing to the virus. So, I mean, it's a difficult thing, and which will mean that anytime people behave in certain ways, they put the health workers' life at risk. Not only clinicians or doctors who are working on patients, but it spans across pharmacists who also handle drugs from patients who come to them, to nurses who support on the ward, to laboratory personnel who handle the samples and process, even to the cleaners. Those who clean the wards, the floor with disinfectants are also at risk. Those who carry the bodies, I mean, when people die, also are at risk. And almost every sector, even the record keepers, those who record patients' vital information, are also at risk. So because this virus is highly, highly contagious, so when one or two people get into the ward with this virus, there's a high chance that many people who come into contact with the virus will become infected. This is quite difficult, and which will mean that we have to do our best to ensure that we all adhere to the precautionary measures, and then also not act in a way not to expose many people to this virus.
Right. Now, I'd like us to focus the conversation on people who are asymptomatic, because we've seen, especially just recently with the Carlos Ahenkra case. Mr. Ahenkra says that, yes, he was tested positive, but he was taking his medication, so he felt that he wasn't going to infect anybody, which is why he went out into the crowd and was interacting with people. But generally, people who are asymptomatic feel that they cannot pass on the virus to others. Is this true?
No, so this is not entirely true. And I think this seems to be breeding a lot of confusion, especially when we had the new discharge criteria, which said that if you're asymptomatic and you are positive, after 14 days, you can de-isolate or discharge the patient, which doesn't mean that those people are free. There are studies across the world, although there is no systematic study or meta-review analysis of these findings. Many studies across seem to point to the fact that asymptomatics contribute significantly to the transmission of infection. So there are two groups of the asymptomatic. Asymptomatic means that you don't have the disease or you don't have the symptoms. You may have the virus, but you may not be manifesting the symptoms of the virus. So we have what we call pre-symptomatic groups. So they don't have the signs and symptoms, but then they have the virus. It's only a matter of time. After 2 or 3 days, they begin to show the symptoms. And then we have the post-symptomatic groups. So these people are, after the symptoms, they also, I mean, will recover and then will feel free. And we have the pure asymptomatics. So these are people that throughout the period of infection, you never see anything in them. So some studies have found out that, you know, for you to be able to transmit the virus to another person, you must have a high load of the virus in you to be able to transmit to somebody. So there seems not to be a difference in the load of the virus in asymptomatics compared to symptomatic populations. So that is one of the things that scientifically we know very well about. And there are two main studies that has shaped the world of science when it comes to understanding asymptomatic transmission of the virus. The first one is what was reported in early days in Italy, in where we call the VO city. They were able to enroll about 2,812 asymptomatic people, and out of them, 41% of them became positive for the virus. And then they followed the contact of these people, for a certain time, more than 14 days. And they realized that although they were asymptomatic, quite a number of them were able to transmit the virus to other people. So this is one of the first evidence that we got, apart from the one that happened in Asia due to the SARS-1 virus. The other one was from the US. Those crew members on the US Roosevelt Tudori crew, where they had about 4,954 crew members who were part of a whole, moving through their crew system. But then 70% of them who were asymptomatic. Later on, when they came down and they were followed up, they realized that those people who were positive, as part of the crew members, were able to transmit to other people who also get the infection. So when these findings were made available, the European Centers for Disease Control had to amend their protocol and said that they will encourage all health workers to put on a nose mask, and will also encourage the general public to also put on a face mask, because putting on face masks and nose masks will decrease the transmission across the country. In Asia, they also made it mandatory, because of findings from China that anybody who goes out should put on this kind of face mask, because we cannot tell whether you are symptomatic or pre-symptomatic. There is a chance that you can transmit. And because you cannot measure this risk, you are better off taking precautionary measures so that you don't transmit the virus to others. So this is what we know. And although it is not a systematic review, the evidence is quite heavy. That is why many countries will advise that everybody should put on face masks or nose masks, because once you do that, you have a chance of cutting down the virus growth significantly, and you can reduce the virus spread and then protect the lives of the vulnerable in the societies and communities.
Right. Of course, we'll be exploring the perspective, the legal perspective of people who go out there to deliberately infect others, and what the sanctions that they face. We'll be speaking to a legal practitioner, Francis Xavier, who will join us on Zoom shortly. But Doc is still with us. So asymptomatics, what is the protocol? Because I've heard people say that their managers say they should continue to come to work because they're strong, they're not exhibiting any symptoms, so they should still come to work and work as normal, go about everything as normal. So what is the protocol when it comes to asymptomatics?
So the protocol for asymptomatics is that after testing, you have to first of all test the people. So if you test yourself, you have to isolate yourself for 14 days. So after 14 days, it's presumed that your likelihood of infecting others will be very negligible. Therefore, you can come back to work. So as soon as anybody, or you go to a facility and you are declared positive for the virus, you have to go under self-isolation, or even to the isolation center for 14 days. And even for that, some advise that even after 14 days, you stay for additional 1 week, making to about 21 days, just to be sure that you don't have any of the viruses around you. And also understand that, you see, if you look at the WHO protocol on de-isolation for asymptomatics, they mentioned that it is unlikely that you will transmit. It doesn't mean you cannot transmit. Your rate of transmission is very low. It is possible you can still transmit when you have a high starting viral load. So it's not completely true that if you are asymptomatic, even after 14 days, you are free. There is still some chance of transmission, but because this is highly negligible, this is why the WHO has gone for this, taking into consideration logistic consideration and many other things that you have to put together.
It's interesting, yeah.
People speak.
Right. It's interesting you should say that, even though there's the likelihood of infecting others even after 21 days or 14 days, because there are many who return after self-isolation, after the 21 mandatory days, and still are able to contract the disease because they have been exposed to it after self-isolating for so long.
Yes, that is also a possibility because as we speak now, we don't know the how well people immune system can protect them from getting the virus in subsequent infection.
Right.
We don't know yet. For the first SARS-1 virus, we know that the immune system, the antibodies can protect you for up to about 2 years. But for this new virus, we don't know yet. So this is why even if you test positive, you have to adhere to all the precautions, put on nose masks until you get a vaccine.
Right.
Until we get a vaccine, we cannot behave anyway and anyhow.
Right.
So if today you are positive and you are discharged after 21 days or after 14 days, it's possible you can be reinfected because you are not too sure whether, one, you have the antibodies against the virus. And even if you have it, for how long will that protect you? Nobody knows. So we are in sort of a difficult situation where the evidence available is not so much to give us confidence to behave in the way we want. We all have to begin to behave very well, adhere to all the precautions, do what is right until we get a vaccine and a cure. This is the only way we can decide to live our normal lives. Until that happens, even if you are positive after 14 days and you go through isolation or whatever, even after that, you must ensure that you follow all the precautions and do what is right so you don't infect your other colleagues at work or anywhere.
Doc, is it possible to still contract the disease if you're asymptomatic, having gone through the self-isolation period, return to your workplace, follow the protocols? Will you still be able to contract the disease even though you follow the protocols, washing hands, wearing the nose mask and the like?
It's unlikely. I mean, it's highly unlikely that you contract the disease again. But once again, you cannot know. So if you have followed through the WHO protocol, we keep using the word unlikely.
Right.
We don't say it is not possible because we don't have evidence to prove that it is not possible. You can only say it will not happen when you have substantial evidence to support that. So even if you are positive and you have recovered and come back to work and you adhere to all the protocols, you may not be infected, which is very good. But then if you don't adhere to all the protocols and you are exposed once again to somebody who has infection and you don't have the immunity to the virus, you'll be reinfected again. And you can also tell in the second infections how your body will respond again to this. So it's not, things are not straight. Ideally, after you test for the PCR positive, after 14 days, you have to perform what we call the antibody test to know whether you have mounted a good immune system to be able to fight subsequent infection, due to exposure to this virus. But then we don't do that in Ghana. We are yet to get access to these kits. So until that comes, you still assume that even if you go through the phase, consider yourself as susceptible and still behave very well. And once you behave well, you put on your mask, you wash your hand well, you do everything you're supposed to do, it is unlikely that you will become infected. We will keep using unlikely because there's a small chance that based on some one or two things, somebody may contract the virus again.
All right. Thank you so much for your time. That's Dr. Michael Owusu. He is a virologist at the Kumasi Center for Collaborative Research with that analysis there. Thank you so much for your time. And the advice is that consider yourself as susceptible and follow the safety protocols. And it is unlikely that you will contract the disease.